We'll see what happens, right? So that concludes member statements, and we will move to our witnesses' opening statement. And I'll introduce each one of you, then call on you. Introduce you as a group, and then call on you to give your opening statement. And those of you who have not testified, I think some of you have, some of you may not have, is that you'll have a green light. I think it goes for 4 minutes. The green light's for 5 minutes? Okay. They have 5 minutes to testify. 4 minutes, you'll have a green light. Then you get a yellow light. And once you have the yellow light, that shows you got a minute left. And when the red light hits, it's time to wrap up, and we'll move forward. So today I will first introduce Dr. Michael Schlosser, Senior Vice President of Care, Transformation and Innovation at HCA Healthcare. Dr. Benjamin Nguyen, and you said that was a proper pronunciation of your name, Senior Product Manager, Transcarent. Mr. Peter Shin, Head of Digital Health, North America, Siemens Healthineers. Dr. Christopher Longhurst, Chief Medical Officer, Chief Digital Officer, and Association Dean, U.S. San Diego Health. And then also Dr. David Newman-Toker, Director, Division of Neurovisual and Vestibular Disorders, Department of Neurology, Professor of Neurology at Johns Hopkins University School of Medicine. Appreciate you all for being here and taking the time to be here today. This hearing is important, and I will begin by recognizing Dr. Schlosser. You're recognized for 5 minutes for your opening statement.
Thank you. Thank you.
Make sure your microphone is either on, and then it's up to your, if you'll lift it up, it should bend towards you. There you go.
Thank you. Thank you, Subcommittee Chairman Guthrie and Ranking Member Eshoo, as well as Chairman McMorris-Rogers and Ranking Member Pallone and the esteemed members of this committee for inviting me to testify here today. I am Dr. Michael Schlosser, Senior Vice President for Care Transformation and Innovation at HCA Healthcare. I have a background in neurosurgery, in hospital operations, and deep involvement in healthcare and AI technology, and so excited to share my perspectives and how HCA is approaching AI in healthcare. At HCA Healthcare, our commitment to integrating AI into healthcare is driven by a vision to enhance patient care and operational efficiency and effectiveness. Our initial use cases are focused largely on removing administrative burden from clinicians, providers, and leaders so we can return precious time to them, allowing them to focus on patients, critical decision-making, and other high-risk activities like transitions of care. Allowing these colleagues to function at the top of their license will create expanded healthcare workforce with the time and tools to deliver a superior standard of care. To achieve these goals, our first step was to develop a responsible AI program involving a robust governance structure to ensure our AI applications are fair, robust, accountable, and continuously evaluated for safety and effectiveness. The stated goal of the program is to both govern and enable the use of AI across our organization, ensuring the technology is used responsibly, but also ensuring we take full advantage of these innovations and the benefits they can provide to our care teams and our patients. When it comes to privacy and security, we have several decades of experience in protecting patient data that has positioned us well to meet the challenges of deploying AI in a secure and private manner. Building on our experience managing patient data under the HIPAA standard, we ensure that all our AI applications adhere to these stringent standards. Patient data and the output of any AI model that could include protected health information about our patients, as well as the models themselves, are all protected in the same way. Private and secure is also a key feature of our responsible AI program. Finally, we are deploying a new data architecture to support our AI agenda, which focuses on de-identified data sets as the primary source of training data. This allows for the use of large data sets to develop models in advanced analytics without having to expose individual patient PHI. Another safeguard that we have implemented is a human-centric approach to AI. In all our AI applications, we emphasize a human-in-the-loop approach. This ensures that when we leverage AI for efficiency and accuracy, we do not compromise on safety and responsibility. The human-in-the-loop models also allow for ongoing model development through direct feedback provided inside the workflow for those using the models. The more the models are used, therefore, the better they become. Finally, when it comes to AI-driven decision support tools, these are the models where they are directly advising on the treatment or diagnosis of patients. We believe this is an exciting opportunity for AI in the future, but an area that requires significant testing and research before they can be deployed safely. So with my final time, let me add just 3 examples of how we're using AI in healthcare across HCA. The first is enhancing clinical documentation. We have a system in a partnership with Augmetics where AI can listen to a provider interview a patient in the emergency room. This is live in 4 ERs, and then transcribe the event, and then using natural language processing and large language models, turn that into structured clinical documentation, moving documentation into an AI assistant mode rather than the doctor as a data entry analyst. The second is streamlining nurse handoff. Nurse handoff occurs almost 400,000 times every week across our 183 hospitals. It's a risky time during a transition of care. We've taught a large language model to read our EHR data and therefore be able to interpret that data and create a handoff tool that the nurses, after they review it themselves, can use to drive that conversation. This will bring standardization and safety to a highly variable and risky time during care delivery. Finally, we're using AI for staffing and scheduling. We've taught an AI algorithm to understand the data surrounding how our care teams are deployed in our hospitals. Care teams are our most valuable resource, and ensuring we have the right team in the right place at the right time with the assistance of an AI algorithm is proving to be able to create more balanced, fair, and equitable schedules for our care team members. So in conclusion, at HCA Healthcare, we are dedicated to exploring and leveraging AI to enhance patient care and experiences, improve operational efficiency, and uphold the highest standards of privacy and security. We are committed to ongoing dialogue with Congress and with the subcommittee to help ensure the pathway forward provides all the opportunities that our patients deserve.
Thank you. Thank you for your opening statement. The chair now recognizes Dr. Nguyen. You're recognized for 5 minutes for your